video is intended to help you understand the medication that you are taking called an anticoagulant. After watching this video, you will understand what is an anticoagulant, why you are on anticoagulant, how to take your medication, what are the potential side effects of anticoagulants, and what precautions you need to take while on anticoagulant medication. This video is intended for patients prescribed with anticoagulants for educational purposes only. Always discuss with your doctor or pharmacist if you have any concerns regarding your medication. Anticoagulants are blood thinning medications that are used to treat and prevent blood clots from forming in your blood vessels. Some examples of anticoagulants are warfarin tablets, rivaroxaban tablets, apixaban tablets, and dabigatran tablets. Anticoagulants are used for a number of medical conditions to treat or prevent blood clots in the legs or blood clot in the lungs, prevent stroke when there is irregular heartbeat, and prevent blood clot from forming after hip or knee replacement operation. The doctor would have started you on an anticoagulant medication for any one or more of the above conditions mentioned. Check with your doctor or pharmacist if you are not sure why you are on anticoagulants. Let's go to the clinic where Madam Lee has been started on an anticoagulant for the blood clot in her leg. She will be counselled on how to take her medication.
Good morning.
Good morning, Madam Lee. You have been given an anticoagulant by your doctor to treat your blood clot in your leg. Based on your anticoagulant, this is the dosage you should follow. Do remember to take the tablets after food if told to you by your pharmacist. Ensure that you take your anticoagulant daily. If you miss your dose for one day, you are not protected against your blood clot.
What if I forget to take the dose?
If you forget your anticoagulant today, do take it as soon as you remember. In the event that you only realized that you forgot the dose the next day, take your dose as prescribed. Do not take 2 doses at the same time to make up for the missed dose. Resume taking your anticoagulant the following day as per your usual timing.
How long do I have to take this medicine?
Your treatment may be long-term, depending on your medical condition. Check with your doctor on how long you need to be on anticoagulants.
Are there any side effects to this medicine?
Some common side effects include stomach pain, nausea, or vomiting. You can take the medication after food to reduce these symptoms. You may experience some forms of bleeding, such as bleeding in the gum while brushing your teeth, unexplained nosebleeds, or get bruises more easily. Check with your doctor if the bleeding doesn't stop in a few minutes. Use a soft bristle toothbrush and floss your teeth gently. There may be increased menstrual flow. Check with your doctor if you feel unwell. See a doctor or go to the hospital immediately if you have the following symptoms. Any signs or symptoms that might indicate internal bleeding, such as black, sticky or bloody stools, coughing out blood or brown material, unexplained bruises or bruises that are getting bigger, blood in urine, severe headache that doesn't go away, giddiness or confusion, sudden stomach pain, sudden backache or joint pain, or sudden shortness of breath. If you experience a drug allergy, you should stop your anticoagulant and see a doctor immediately. Signs and symptoms of drug allergy include swelling in the face, eyes, lips or tongue, difficulty in breathing, or itchiness on the skin or rashes all over your body. Blood clots may still form when you are taking anticoagulants. The signs and symptoms depend on where the blood clot is formed. These include swelling, redness, pain, warmth and numbness in the legs, chest pain, shortness of breath or coughing out blood, or stroke symptoms such as muscle weakness, difficulty in speaking, blackouts, giddiness, blurred vision, or facial drooping.
Are there any precautions I need to take while I'm on this medicine?
Avoid any sports or activities that might cause you to fall or be injured. See a doctor if you have a fall or injury. If you plan to go for any surgery or procedure, such as endoscopy or dental treatment, do inform your doctor, pharmacist, or dentist that you are currently taking anticoagulants.
Are anticoagulants safe in pregnancy or breastfeeding?
Most anticoagulants should be avoided in pregnancy or breastfeeding. Inform your doctor if you plan to have a family or if you are pregnant.
Are there any foods that I should avoid while I'm taking this anticoagulant?
Depending on the type of anticoagulant you have been prescribed, there may or may not be a need to monitor the amounts of certain food you consume. For example, if you are on warfarin, foods rich in vitamin K have to be consumed in moderation, whereas this does not apply if you are on a direct oral anticoagulant such as apixaban, dabigatran, or rivaroxaban. To maintain good health, keep a balanced and healthy diet.
Are there any medications or supplements I need to avoid?
Yes, there are certain medications or supplements which affects the way the anticoagulants work. Always inform your pharmacist or doctor that you are on anticoagulants and other medications or supplements you are taking or recently started. Medications which influence the effects of anticoagulants and may increase the risk of bleeding or new blood clot forming include some antibiotics to treat infection, such as rifampicin and erythromycin, anti-seizure drugs to control fits, such as carbamazepine, phenytoin and phenobarbital, some antifungal drugs to treat fungal infections, such as fluconazole, some antiviral drugs, such as ritonavir, some medications that control your blood pressure or heart rate, such as diltiazem or verapamil, groups of painkillers called non-steroidal anti-inflammatory drugs, such as ibuprofen or diclofenac, or herbs, such as St. John's worts.
How do I store my medicine?
Store anticoagulants in a cool, dry place away from direct sunlight and away from reach of children. It's not necessary to keep them in the fridge. Do you have any other questions for me?
No. Thank you so much for explaining about my medication.
Thank you, Madam Lee. Hope to see you in your next appointment.
Okay, thank you.
In summary, anticoagulants are blood-thinning medications that treat and prevent new clots from forming in the blood vessels. They are used to treat blood clots in the legs or lungs, as well as preventing blood clots caused by irregular heartbeat, hip or knee replacement surgery, and in heart disease or peripheral artery disease. Anticoagulants should be taken as prescribed by the doctor and with or without food depending on the dose. Do not forget to take your dose daily. The potential side effects of anticoagulants include stomach discomfort or bleeding. Seek medical attention if you have serious bleeding. Avoid contact sports, high-impact activities, and take caution to minimize the risk of falls. Inform your doctor if you are pregnant, breastfeeding, or planning to start a family. Inform your pharmacist or doctor if you are taking medications which may affect how anticoagulants work, or if you intend to go for any injections in the muscles. The information provided in this video does not replace the advice given by your doctor. Please consult your doctor for more information.